take this off?
Yeah, you can.
Just feels like a struggle to breathe.
Yeah. And who do you have with you today?
That's my partner, mother of my kids.
Hi, how you going? So I'm one of the doctors with the radiotherapy team. We've received a referral to have a chat with you from the medical oncology doctors over the road. And they've filled us in a little bit on what's been happening over the last month or so.
6 weeks.
Yeah. And I guess the purpose of the consultation today is if there's any way that the radiation plays a role in your treatment to help with things.
It's supposed to, isn't it?
Yeah. What have they told you over the road so far?
They told me 6 weeks ago I had 3 weeks to live, and that's it.
Okay.
And if I did chemo and shit like that, I'd have 6. So then they fucked up the biopsy.
His wife by a few months.
Okay.
And now I'm here at 6 weeks.
Yeah.
Still functioning quite well too.
Yeah.
He's just in a lot of pain and discomfort. And
I just want
weird.
to, my head's all fucked. I take it it's because of the cancer, so
Okay.
need to do this
You want to start treatment.
radiation and shit.
Yeah.
as soon as
And you've had
possible.
your second biopsy, the biopsy of the neck? That was done on the last
Last week. Yeah.
week? Okay.
So what?
Do you have the result of that yet? Has anyone told you?
No, we haven't been
That's
told.
what I thought this was about.
Okay. We can see if the result has been done. We didn't order the test, so we didn't get the result.
Oh, okay.
So it would go to your oncologist over the road, but we
Okay.
can chase it up to see.
Yeah, if you could, because we don't know what even type of cancer it is or anything yet.
Yeah. And have they've booked you in?
He's booked in tomorrow down at Maroondah Breast and Cancer Clinic.
Yes.
For his first start of treatment, obviously.
Okay.
Is that it or what? Because I don't know.
To start like chemotherapy or something like that?
Well, we
Is that
don't know
what-
because we presumed that we were going to find out what type of cancer it was, and then we would be informed about.
Like, what's this appointment for?
This appointment. So there's.
Now I'm confused. Like,
Yeah. So when we think about looking after patients with cancer, there's 3 types of treatments that you have available to you.
Chemo, radiotherapy, and
And
immunotherapy.
and then surgery as well. So I guess 4.
Yeah.
So we're just the radiation doctors. We don't do
okay.
any of the chemo or anything like that.
So do you think he requires radiation?
He doesn't know because he hasn't got the results.
Possibly. Well, I mean, we've got all your other results.
Oh.
We've got your MRI. We've got your PET scan.
Yeah.
We don't have the result from your biopsy on the 11th. But I'll see if we can.
Yeah.
get
So
it.
tomorrow's at Maroondah Hospital.
Okay.
Breast and Cancer Clinic.
Yeah.
Private Oncology Clinic.
Sure.
So by the other scans though, like the radiation help or?
Well, when you say you've got pain, where is your pain?
Everywhere.
Everywhere?
Like, my whole body's fucked.
Yeah, his whole body is starting to get sore, and like he sort of lost a bit of
And,
motor
like,
function yesterday.
Yeah, I fell over, hurt my fucking self.
It's mainly in his head.
Yeah.
And
Headaches?
It's not even headaches, like my head's just not here.
Okay.
Like it feels like I'm watching everything, something, like I got PTSD again or.
And occasionally he said he feels like he's been ice picked in the top of the head.
Yeah.
Okay.
Keep getting like that. That's the best way I could put it. It was like someone stuck a fucking ice pick in my head.
Yeah.
So he did have a lot of the brain swelling and stuff like that. So they put him on 16 milligrams of steroids in the morning.
Really?
Yes.
I've been on that for 6 weeks.
He's been on that for 6 weeks. We don't know if that's the right medication still to be taking. We really need a whole over review of everything because we're just getting fluffed around and it's quite poor treatment.
Yeah.
And care.
That's a big dose of steroid that you're on.
Yeah.
How is your sleep going?
I haven't slept.
He's barely been sleeping.
I slept like 4 hours in 6 weeks.
Yeah.
I can't sleep. I just go to sleep and I wake up.
Yeah.
And then
So
she's
he
like,
took 2 temazepam the other week.
Yeah.
So 20 milligrams of temazepam and then 4 milligrams of melatonin. He was asleep for an hour.
Yeah.
was I even?
Yeah.
And you take 4 steroid tablets first thing in the morning,
Oh, yeah.
like the deaths. Yeah.
Originally they prescribed it morning and night, but he was not sleeping at all and getting really
being
angry and
psychopath.
stuff, and so they
Yeah.
moved it all to the morning,
Yeah.
and it has been a bit better, but yeah.
Do you still feel as if the dexamethasone is making you feel like quite elevated and
I don't
like
have a
pressured
clue.
and you're not sure.
No,
what
I don't.
I literally don't know anything.
No, I don't think it's
Like,
making him
everything just
roid
feels
out
fucking
and all
fake.
that sort of stuff.
Like constantly every day for the past like week and a half, it feels like I'm in a dream or something. It doesn't feel like, nothing feels real.
Okay. Yeah.
He coughed up what I think was a bit of lung before earlier too.
Yeah, I'm pretty sure I coughed up lung.
Uh-huh.
It was like the weirdest looking fucking thing. I
It
thought
was
it was like
very odd looking.
I thought it was like infection or something because I felt like I was sick. But then
Yeah.
as soon as I coughed it up, I feel fine. And
So they originally took 9
It's like
clicks
this.
of pneumonia from his lung when they did the lung biopsy,
Yes. Yeah. I saw that. Yeah.
and he hasn't been put on another course of antibiotics. So I don't know if he requires that, if it's helpful.
Okay.
We really need a med review with
Yeah.
someone that knows what they're talking about.
Yeah.
We've completely lost faith in Zen.
I want to punch the
So
fuck
we're
out of
actually
him.
going. Can you stop? So
Well,
we're actually
he's
going to request.
ruined my life.
Yes, I know.
He told me I had 3 weeks to live, and he ruined my fucking life, and I'm still here 6 weeks later with no medication, no chemo, no nothing. He fucking lied to me, and then he tries to tell me that he didn't even say it, has an argument with me about the time that he said, because I said, you didn't say a month, did you? You gave me less than a month, and he's like, oh, well, yeah, I did. So I want to punch the absolute fuck out of him.
Relax.
Like, it's you can't do that to people. Like,
You can't, but that's not what
but
we're
he
here
did,
for.
you know,
That's not what we're here
because
for.
he can, because everyone can just say what they fucking want to me while I'm dying, and it's okay. It's not okay. So he better not be anywhere near me today.
Yeah. No.
So
He doesn't work.
we will
here.
be requesting another oncology doctor from
Sure.
Box Hill.
Yeah.
Because we've completely lost faith in his actual capabilities
Okay.
and
Yeah.
care.
Yeah.
Um,
I'm very sorry that was your experience with what happened.
yeah,
Yeah.
highly illegal too.
Like I've been
so
walking around like acting like
what
I'm
are the
dead
next
for the last
steps?
6
Yeah.
weeks.
Yeah. So I guess first of all, what other than the Dex, 16 milligrams a day, what are your other medications?
He's on 100 milligrams of
Epilum.
Epilum morning and night.
Then that could be making me feel like this way because I did last time, that's why I didn't
Yeah,
take
so
it.
he,
I just smoked weed to control my epilepsy because I've smoked weed since I was like 13,
Yeah.
he
and when-
doesn't anymore.
and now I haven't
Completely
been.
quit.
Okay.
And
Yeah.
now the last 2 days I've just been like, I should just get stoned because I can't fucking sleep,
Uh-huh.
but I don't want to
But the
because I've quit.
Epilum, when we trialled that way back like 15 odd years ago, he quit weed then too, and we trialled lots of anti-seizure medications, and I was pretty sure it was the Epilum, the valproate, that made him actually like get auditory hallucinations and stuff.
Mm.
But he's been taking it regularly because he was scared, you know, that
Yeah.
of everything that's going on.
Yeah.
But
trying to do the right thing. I'm trying to do what the doctors have been
Yeah.
telling me to do.
but I'm not sure that that's actually helpful
Okay.
at the moment.
Yeah.
Um,
Are you on any other anti-seizure medications at the moment, like
No.
Keppra or anything like
no.
that? When was Keppra? So, because you presented with a seizure, that's how this all started.
No, I presented with a headache.
No, he presented
Headache.
with a headache.
Yeah.
Okay. Did
And
you
there
have
was
a seizure?
There was query
seizure.
seizures.
And then and in that context, they restarted your.
They
Epilum?
didn't know what to do. They just put him on a whole bunch of drugs, I think.
Okay.
On the precautionary measures that, you know, because of the swelling in his
Yeah.
head that he may seize.
Yeah.
But then the MRI showed, I think the swelling's reduced slightly.
Yeah.
It's swelling reduced because I've been taking so much steroids.
Yeah.
It will be. Yeah.
That's
yeah.
right. But the grey matter has significantly expanded.
Uh-huh.
But Luke's presenting still quite lukey,
Yeah.
so it would suggest that his brain's sort of making new pathways around that grey matter.
Yeah. Yeah. And so who restarted your valproate then?
It was in when we presented at Box Hill
At Box
originally
Hill.
on Good Friday.
Okay.
So he's also taken, because on Anzac Day his whole body was like misfiring. It's
Mhm.
like he was seizing, but he was fully conscious.
Yeah.
So his whole body was just like,
You should have let me die then.
it was full on.
Yeah.
We did. You went on a palliative care driver.
Yeah, you put me on a driver instead of just letting me die.
If your body was going to die, the palliative care driver would have helped you.
It's not.
Yeah. You're pretty. You're young and resilient and
Yeah.
and
I
fit.
really don't
So.
want to hear that. No offense, but it's like I'm so sick of hearing that shit.
Okay.
Like off everyone, not just, like everyone keeps saying, "Yo, you're a miracle, you're a miracle." Like I
Can you
don't
just
give a
stop?
fuck
He's not a
anymore.
psych.
Like, it's so
Um,
stupid. Like
Then query if he needs to be on antis for the pneumonia still,
Yeah.
because wondering if there's still an underlying infection there,
Yeah.
which isn't helpful. I've been giving him Biasolv and Chesty on and off
Mhm.
to just if there's something to help get it up,
Yeah.
a breakup. He's been having 400 milligrams of the ibuprofen, but not regularly, just
Yep.
pain and stuff. He weaned himself off the palliative care driver. And most of the palliative care meds. He's only on oral Ordine now, 5 milligrams per mil, and he's only taking 2 mil when required. And that's when he's in a lot of pain, not just a little bit of pain. He doesn't want to be, he doesn't like the...
Feeling the way I feel every single day now.
Yeah, Luke's
matter if I'm
extremely
taking medication or
intelligent,
not.
always has been. He's been very
I have
high
over 150
functioning.
IQ. I've been Mensa tested numerous times. Like,
He's,
but this is all fucking with my head.
so he doesn't like the dreary feeling in the head and stuff
And
like
they keep
that. He
telling
wants
me
to
to take like
feel very conscious.
anti-psych meds because I can't wake up because they're giving me too many meds and I can't sleep.
Yeah.
Yeah,
And
so
then
the
they're
other
telling me to
day,
take haloperidol and shit, and so it's making me even more fucked in the head.
they told him to have the lorazepam to help him sleep.
Yeah.
That
which
didn't work.
I think it might have helped him
What, for
stay
10 minutes?
asleep a little bit, but not effectively.
Yeah.
And then because of those, he was going a bit nuts in the non-sleeping, so they told him the other day to have a haloperidol.
Yeah.
But yesterday was the day after the haloperidol, and it was his worst day since.
Yeah, like yesterday was like...
So we want an all over review of meds
of course.
to see what can work better for him.
Yeah.
And then obviously starting treatment.
Yeah.
You know.
Yeah.
This is all very new to us, so we don't
Of
really
course.
know what we're.
And any allergies?
No.
I need this whatever, the radiation and stuff, and then
So
it'll
because of
fix the cancer, and
because of
then
the diagnosis
I'll
he
be
was
resilient and young, and I'll heal myself. But it needs to like happen, not
be prolonged.
just keep waiting and waiting and
What's
waiting
happening?
and
It's
waiting.
happening tomorrow.
Yeah.
It's unreal. Like,
So radiation and immunotherapy usually go hand in hand, correct?
They can do, yes. So there's a couple of things that we would be thinking about for radiotherapy. One would be treating the air spots in the brain.
Yep.
yeah.
One and the other role for it is generally if there's a particular area outside of the brain that's causing significant symptoms just in one spot.
So his lung and his liver, and then we found out there's 2 in his neck, and now he's starting to feel like there's.
There's always something in my neck, it feels like.
Yeah.
But it's the brain. I need it out of my fucking head.
Yes. His head that's the main issue.
Yeah. Do you get pain in your chest, like when you take a deep breath in or anything like that?
Yeah, like right here.
Just on the right hand side.
That's where they tried to.
Oh, from the biopsy?
Well, that's where they tried to biopsy. I don't know if that's from the biopsy or.
Yeah.
Because I've got half a lung now, or something. I don't know. I just need my head.
But the progression
fixed.
of the cancer has been extremely rapid. So because of Luke's history, he was having, a few yearly MRIs. So about 12 months ago, he had a completely clear MRI, and a full 12 months before that, he had a whole body CT scan, which was completely clear.
Yeah.
So the progression has been really, really rapid and quite strange.
It's not cancer. It's fucking microwaving.
Maybe it's
It is. It's
amplified.
MM-wave fucking technology. It's the only thing that can do it that quickly and out of nowhere. It's military science.
Do you have pain in your abdomen then?
Yes. So
Yeah.
the they were querying perforation of the stomach post the biopsy of the lung because he had free fluid pockets and gas pockets. So he went on the Nexium 40 milligrams morning and night for that to reduce the stomach acid because it was only small. They were hoping it was a small perforation.
Yeah.
To allow it to heal up on its own.
Yeah.
He's still taking the Nexium.
Good. Yeah.
So.
That's good. So,
Yeah, he said good. Thank God.
Good.
And then we found out that he had a significant met in his liver after the PET scan.
Okay.
That's what I mean. Like, how much can my liver process too? Like,
your liver should actually be okay. Your liver's very big, and the size of the met around the liver is relatively small.
So it's
your
around the liver,
function-
not in the liver?
Yeah, that's right.
Excellent.
cool. Okay, that's good.
Yeah. Similarly with the lung,
That made me feel better.
there's a few
He'll be able to explain it better. He's a better doctor.
spots in the lung. They sit very deep inside in the middle.
Yes. So they're inoperable.
Yeah, there's probably too many to operate on.
Yeah.
Because if you end up trying to cut all of them out, you'll have no lung
lung
left.
left.
We know that. Yeah.
And similarly for radiation, to treat all these spots with radiation puts you at quite a high risk of toxicity from the radiation.
Yeah.
And it probably
I'll fix that.
isn't of that much
Just let him talk for a
benefit because the chemo, like the systemic therapy, whatever the plan is for that, gets everywhere in the body and will
Okay.
cause everything to
So-
shrink down.
Yep.
That's
But
good.
the one place the chemo can't really get that well
Is the
into
brain.
is the brain.
So that's what the radiation's for?
So that's what the radiation would be
Perfect.
for. Yeah, yeah. That would be.
When can we start that?
Yeah, we will try and get it started shortly. I'll have to have a chat with my boss about where the best place for that to take place is.
Yep.
Whether it will be here or whether it will be in the city
Yeah.
Yep.
at Peter Mac in Parkville.
Okay, yeah.
Um,
I used to work.
uh,
I don't care where it happens, I just don't
Yeah.
need it to.
and I'll have a chat with him as well. I wonder about trying to get your dexamethasone dose down a little bit.
Yeah.
That
I
would be
love that.
lovely because he is on quite a lot.
I'm,
And
not-
if he
I'm
doesn't,
a really angry person as it is, like, especially now that I'm straight.
he's
like,
always suffered from mental health issues.
Yeah, I got bullied, like,
But he's got amazing self-control,
really
usually.
badly.
Yeah, yeah. I'm really sorry that this has happened to you, and I'm really sorry and I can understand.
The
I
frustration.
can't relate, but I can get why you're frustrated, and it makes complete sense. And I'm sorry.
I'm more frustrated that the guy told me 3 weeks, and
Yeah.
I'm still
It's
here.
actually
and
ruined his life.
It's ruined my
Yeah.
life. Like,
Because
I
he
went
went like around
like-
going, I've only got 3 weeks, and
spent all my money. I've
Yeah.
I'm in
Yeah.
debt. I've had to spend the last 6 weeks trying to fix mistakes that I made with financially.
Yeah.
Like
yeah.
all because he
Which has
literally walked
elevated
in
the
and told me I
stress and
have
everything
3
as
weeks
well.
or 6
Yeah.
weeks with chemo.
Yeah.
Right, let's
like-
focus on the positives
Yeah.
now and moving forward.
Yeah.
I haven't even had the chemo and I'm still fucking here. So it's
Yeah.
like,
Have
And
you-
he literally looked at him the other week like he was a walking miracle when we walked in for the
Okay.
appointment. He's like, I don't understand how you're still standing in front of me normal.
Yeah.
Like,
Yeah.
just,
Okay.
like
so we're
Need to
really
be fixed.
confident that some sort of treatment's going to work, and
it
the
will
fact of
because
mind
they
over the
can't kill
matter.
me.
And
So
Yeah. It looked like I
It's very strong.
guess it looked like you had some kind of coexisting infection when you presented to hospital, or something that really knocked you around and
yeah, I'm not.
I don't
Yeah,
have a clue.
but-
Like
It was
I was
intense.
fine that day, and then
Yeah.
he just walks in and he's like,
The first
got
day
3
that
weeks to live.
he came in, and we were sitting in, I knew there was something severely wrong.
Okay.
Like he was losing his balance.
yeah.
His vision was getting affected, and so he actually sat in emergency patiently for
Yeah.
4 hours, which Luke never does.
Yeah.
So I knew something was really, really wrong, and then they started doing coordination tests, and then it's all just sort of stemmed from there.
Yeah.
But yeah, the oncology team over there has not been fantastic.
Okay. All right. And so I guess just to get an idea of what we can do with your steroid medication, do you wake up with a really bad headache every day?
no.
No. Okay. But every so often you're getting these really sharp
Yeah, well,
feelings.
it's only happened twice when I've been
Okay.
at JB at Knox. It's literally the
Yeah.
same. It happened at the same spot.
Yeah, it was actually really odd.
Okay.
I was the one that realised. I'm
Yeah.
like,
Yeah.
that's where you told me you got ice picked last time, and he
Yeah.
lost like almost.
I almost fell
Like
over.
he
this time.
felt when I held him, he felt like limp, but I could
Yeah.
feel all his muscles were like rigid.
Yeah.
Does that make sense?
Yeah. Okay. And do you have you had any nausea or vomiting?
No.
Minimal.
Minimal.
And that was
Vomit
only
Yeah.
post.
Like I feel like
the medica-
city sometimes because I haven't eaten.
That was
Yeah.
only with the medications from the palliative care driver. He was
Yeah, okay.
feeling nauseated.
Yeah. All right. And when you say you almost had a fall, is that situation where you're at JB? Is that what you're
No,
talking about?
I went to get a Dim Sims.
Yeah.
I just,
His vision is
Yeah,
blurry
my vision's
constantly,
constantly blurry.
and
Okay.
so. But it would, like I said to him, it would have been a step that I would have fallen over. It was like a little lip.
Yeah. Okay.
So-
Oh, you tripped on something.
yeah,
Yeah,
I just
yeah.
tripped
Okay.
and then
All right.
just smacked into the wall.
Have you noticed any weakness of your arms or
yeah,
your legs?
Yes.
Yeah, my legs definitely.
His legs definitely.
Constantly feels like I've got no like I can't stand up
Yeah.
unless I actually focus on it. But then I think that's the steroids.
Yeah.
And he's
As soon as
been
I
getting
focus.
quite a lot of
Pins
lower
and
leg
needles
edema
and-
and swelling
okay.
and stuff.
Yeah. And how much weight have you lost?
About 4 or 5 kilos.
Yeah, I'd have to weigh
Predominantly,
myself
he's
now, but-
always sat around 60 kilos.
Okay.
And
I've
then
always
when
been 59 to
he
60.
was dying and on his last hours over Anzac Day, at Anglers.
Yeah.
Over that week, he went down to about 54.
54.
Yeah.
But now we've got him on Sustagen.
I've been eating a lot.
He's been eating a hell of a lot too.
But I would have thought I would have put on more weight.
But you are filling out more. Like his chest doesn't look like anywhere
The
near
first time in my
as-
life, you can't see my rib cage. So
Okay. Yeah.
which is good. Another reason I don't want to
So he's
start
back up to
smoking.
58, is it?
I don't know. I'd have
Yeah,
to wait.
that's alright.
Yeah.
Any fevers, chills, or sweats?
Not like
No.
specifically. I just it's like a constant. My body temperature won't.
Yeah, his body just keeps fluctuating. It's like he's not been able to regulate his own temperature properly.
Yeah.
And the cough, when you're bringing something up, is that happening every day, or it's just every
I'm
so
not
often?
actually bringing anything up.
No,
It's just
okay.
like the feel, except for today where
Today,
I
and yesterday he coughed up a little bit of blood.
Yeah.
And that hasn't happened since he went into the Anglers around Anzac Day. He was coughing up a hell of a lot of blood then.
Mm-hmm.
But that's when I also put him on a course of antibiotics. I figured if he was going to die, the antibiotics weren't going to save him. He was on a palliative care driver anyway.
Yeah.
So I did ask for them to put him on a course of antibiotics, and that seemed to have
Picked you up a little bit.
and decreased the coughing and blood. It's been a bit of a road. They literally told us he was on his last hours on Anzac Day. We got family, the kids in. We've got three
I won't
boys.
die. Like it's the same thing that happened when I got tomahawked. Like I wouldn't die. So
So he was
when it
attacked
comes
in
to
a home
like
invasion.
the radiation and shit, I just want it all because I'm pretty sure no matter what you say about toxicity, it's not going to kill me because I can't die. So I'll just heal myself. Like I have every other time. So
well, I think probably what we'll do is we'll start with
the radiation
the
to the
brain.
head, perfect.
And we'll see how you go with your chemo. And then if there's any spots that are not responding that well or causing you problems, we can think about treating them.
Because there's already like a 2 centimetre met in one of his back occipital lobes.
Yeah, so this is your MRI.
Which is quite a rapid progression. It's really odd for the time frame.
Yeah, it can unfortunately grow quickly like that. So this is your where are we? Head here, cut this way. These are your eyeballs at the front and your nose. So this is the back of your head. Now as we're coming up through, anywhere there's a little white ring is where there's a little tumor. So there's 1, 2,
it's about 4.
3.
Fucking hell.
There's probably about 6, 4. 4. There's a bigger one over here somewhere. 5.
Jesus fucking Christ.
5, and then there's another. There's another one kind of towards the front here. There.
Yeah.
6.
Cool.
There's 6 or 7. They can all, 5-10 years ago, we would have treated them by giving your whole brain radiation therapy to a lowish dose. Now we can just target them specifically and try and get them under control. And the radiation has a very high chance of doing that, like over 90% for each particular one.
Excellent.
That makes me feel better.
Yeah, it doesn't affect the risk of another spot in your brain popping up.
No, we know that.
But we would put you on a surveillance protocol where you'd get an MRI every 3 months.
Excellent.
So if anything else comes up and a small thing in the future, we just then treat that when it arises. I'd expect we can probably do them all in a single treatment, but we're going to need to redo your MRI because it was done on the 11th, but we'll do it all as a kind of little package, kind of get the MRI and the treatment all done within a few days of each other.
Perfect, thank you.
Because we really need the machine that
very
we use
current.
is very accurate, like 1 millimeter tolerances.
Yes.
And so if they're 1 millimeter different in size, then all of a sudden we're missing
things.
So given it's been a month, we'll just need to
No,
get a
it's
new
like,
MRI.
I had
and
a
then
dream that you were going to tell me there's nothing you could do. So that's why I know I slept last night. I had 2
I told
dreams
you they
about
wouldn't
Nintendo
say
and
that.
about hearing fucking the
They're
worst
gonna
fucking
wanna
shit.
Zap you with everything.
Yeah, there's lots that we can do.
That's good.
We can do.
It's very good.
The treatment itself is painless. You don't feel anything when it's happening. It's just very high energy type of X-ray. We do need to make a mask that holds your head very still, like a very tight fitting plastic mask, custom molded to your face.
Okay.
And then once you've had the treatment, sometimes there can be a bit of swelling, like the radiation can cause things to swell a bit more before they settle down. So we'd usually keep you on a little bit of steroid, but 16 milligrams I think is
way too much.
Is kind of overkill at the moment, I think.
What would you suggest?
So given you've been on 16 for so long, we're going to need to kind of come down a little bit slowly. Or I'll give you before you go a schedule to wean, but it'll probably be every 4 to 5 days. We'll cut down. But from tomorrow we can maybe go to 3 tablets a day for 4 to 5 days, and then 2 tablets a day for 4 to 5 days. But if at any point while you're cutting down, you're getting bad headaches, bad nausea, seizures, then you can need to go back up and call us.
Okay, cool.
Can he stop the Epilum? You wouldn't suggest
have
it?
you haven't had seizures
He
since?
hasn't had seizures. I've not even thought he's had like a...
What was the seizure they thought
tonic-clonic.
you had when you arrived into hospital initially?
The one that I had witnessed was... So Luke previously, when he first got diagnosed with epilepsy, was having full convulsive seizures. But the one that I witnessed prior to him complaining of the head pain a few days before was he just went really rigid and like out of it and all over body sweats for a bit. So I'm not sure if it was actually the tumour and the brain,
I'd rather
or if it was
stop
actually
the Epilum and see if I have a seizure, and then if I do, then do something about it, because like that shit never made me feel good. That's like at all, and I strongly think that that's what's making me feel like out of my mind. Like is the epilepsy medication.
Have you ever tried Keppra before?
No.
Not that
I just kept smoking because the neurologist told me to keep smoking weed.
The neurologist literally said to start smoking again because it was obviously keeping him seizure free.
Did you see a neurologist? Did the neurology team come around to see you while you were in hospital? No. Yeah.
Which I would have thought they would have, but they didn't. So.
Let me try and get access to what unfolded over there.
Yes.
And I'll get in touch with you, because if it's possible they spoke to the neurologist by the phone and they recommended Epilum.
Possibly.
Usually we'd use a different drug called Keppra, which is a drug where you don't need to monitor its levels and things like that. It generally has fewer side effects. But there might be something about your past history of epilepsy that means they've recommended Epilum instead. I'm not a neurologist, so I don't know. So I'll find out for you.
Thank you.
And we'll work that out. We'll wean down the steroid. And then we'll think about then we'll organise this radiotherapy.
Should he still be taking like the bisolven?
Bisolven is just as you need it if you find it helpful.
Yeah, that's what I thought.
Yep. Nexium, if you've got the risk of a stomach ulcer, you definitely need to be taking it. And it also is important while you're on the steroid. And then the Ordine you can take as you need it.
And the melatonin's not going to affect any of the meds or treatment?
No, melatonin's fine.
And what else were you having?
How much melatonin are you having a day?
I'm not. I tried having it to help me sleep. But
and the lorazepam and temazepam and stuff is really just because you're on the decks and you can't sleep. So that doesn't affect anything.
It's trying to counteract it,
Hopefully we can get all of them
He's literally on minimal
back a little
meds.
bit. Okay. And how do you guys get in here?
I drive.
Yep.
We do have 3 boys that we drop off at school.
Okay.
So this time's perfect to get here by.
Okay, sure.
I feel better. This is a good appointment.
And
I told you they're better doctors.
Do you mind if we just have a seat over here? I just wanted to see what your strength is like in your arms and your legs. Just sit on the edge there. Just nice and floppy with your hands. That's good.
And my arms are like kind of more fine. It's just my like bottom half.
Yeah, okay. Up like this. Nice and strong. Push me up. Good. Like this. Push me away. Yeah, push me away. Good. And like this again. Pull in. Yeah, pull in. Very good. Out like this. And push up at the wrist like a, yep, that's good. And up at the wrist. Good. And push your leg up. That's good. As hard as you can against my hand. That's good. Up as hard as you can. And push down. Good. And push down. Good. And kick your leg out. And kick your leg out. And pull in. Good. And pull in. And do you have any feeling of like altered sensation over your legs at the moment?
Like it just doesn't feel right at all.
But kind of all over?
Yeah.
Yeah. Okay. Alright.
Like weak but not, but weak.
Yeah.
Yeah.
And now, just with you testing your eyes, just have a look at my finger here. Could you follow my eyes with your finger, keeping your head still? Yeah, just
Follow your finger with his
follow
eyes.
my
He
finger.
did right.
Follow my finger with your eyes. Any double vision?
Yeah.
Everywhere.
It's like just blurry constantly. Like I tried to like keep it normal by playing games, but I haven't been able to do that for like a week and a half.
Okay. And then I'm just going to shine this light in your eye, if that's okay. And have you noticed any numbness over the face?
Not really.
Not really. Can you close your eyes nice and tight? Good. And open them and bring your eyebrows up. Like surprised. Yep. And puff your cheeks out. That's good. And stick your tongue out for me, and tongue that way, and that way. That's all good. Thanks. You can have a seat.
What are the symptom side effects?
Yeah, so side effects of the radiotherapy, if you get some swelling in those areas in the days after treatment, they can cause headaches, nausea, vomiting,
Yeah.
unsteadiness on your feet, potential risk of seizure.
Yeah.
But that's why we keep you on a
On
little
all
bit of
those meds.
medication
Yeah.
while we're doing it.
Perfect.
Other than that, you shouldn't really get, I don't think you'll get any hair loss or anything like that from the radiation.
Good.
You shouldn't get any skin reaction, you shouldn't get any inflammation of your throat or anything like that. It's so targeted.
Excellent.
What the main thing to be aware of is that there's a risk that's around about 10% or so that the radiation, because it's at such a high dose, it's very good at controlling the tumour, but sometimes it can cause a bit of damage to the normal brain tissue around.
That's right. He's
gonna
already
happen.
making new pathways.
Yeah.
Yep.
It's called radionecrosis in the
Okay.
usual case. It doesn't cause symptoms. It's just something we see on scans.
Yeah.
But it can, 3-6 months down the track, cause, if there's significant radionecrosis, it can cause similar problems, headache, similar
Yeah.
problems if
Similar
the cancer
problems.
was there.
Yeah.
Okay.
Yeah.
And
without
it
cancer.
can become a little bit of a dilemma trying to sort out whether it's cancer growing back or whether it's
Okay.
just the treatment being too effective.
necrotic.
Okay.
Yeah,
That I
but
don't mind.
that's something.
Yeah, because the grey matter's significantly grown from the MRI that we've originally saw with the tumours.
Yeah,
But he's still presenting so well.
Yeah.
So yeah,
It's called IQ.
love the brain.
yeah.
Love the human
Yeah,
body.
I think there's certain areas. It's mostly confined to the back,
The back,
Yeah,
yeah.
which
which
so
is
like his
responsible for your
vision.
balance, coordination,
Yeah.
and vision.
Yeah.
I think there looks like there's kind of sparing of the language areas, sparing
Yeah.
of the main kind of motor areas
what I
and
noticed.
sensation areas. So
That's
the
good.
bits that I need are not affected. so-
yeah,
Yeah.
yeah.
The rest
I think
of the
there's
meds.
too many and they're too small for us to cut them out with surgery, which
Yeah.
would be the other option.
Yeah.
But I think that doesn't provide any benefit for you.
No,
No.
I don't think so.
Yeah.
Especially with this new technology you're talking about. It's very
All right.
targeted.
Have a seat. I'm just going to have a chat with my boss. His name's Andrew Worth.
Yep.
And then we'll come in and we'll confirm what we're doing.
Yep, sure.
I'll be
Sorry,
back
what
in
was
a
your
minute.
name again?
Matt.
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 Thank you.
Oh, cool. This is good.